have you. All right, so let's jump in. So welcome again. My name is Lauren Jones. I use she, her pronouns, and I'm the Director of Diversity, Equity, and Inclusion here at the School of Public Health at the University of Minnesota. Before we begin, I want to acknowledge that the School of Public Health at the University of Minnesota Twin Cities is built within the traditional and contemporary homelands of the Dakota people. Minnesota comes from the Dakota name for this region, Minnesota Makoche, which loosely translates to the land where the waters reflect the skies. We'll be sharing some concrete resources for supporting our Indigenous relatives in the chat. I also want to point out that closed captioning is available. You can access that by using the icon in the bottom right corner of your screen. You can also reach out to Sarah Harris, who's providing our tech support today via the chat to ask questions about accessibility. We will monitor the chat for questions as well as share links to our evaluation and information about future Justice in Public Health events. The Justice in Public Health series was started in 2021 as part of our commitment to justice and anti-racism. We've been hosting monthly events with local and national experts around topics of public health. The speakers and presentations in this series help to ground us in theory and practice, as well as complement the classroom learning that our students experience. We also hope that today's discussion is part of a broader change happening outside of the School of Public Health. If you are interested in staying abreast of other Justice in Public Health events, please be sure to fill out our event evaluation after this and check the box to receive notifications about upcoming events. You may also visit our website at any time. This event will be recorded and will be available to view on our website for about 180 days. Now I want to welcome our speaker for today. Kyle X. Hill is an Ojibwe Turtle Mountain Band enrolled citizen, as well as Dakota and Lakota Cheyenne River Sioux tribe. Dr. Hill is an active in community-based participatory research with American Indian and First Nations communities in the U.S. and Canada, focusing on research projects across social, behavioral, and environmental health. Specifically, his primary line of research considers the social, political, and ecological determinants of Indigenous health, as well as the intersection of climate justice and land-based healing within Indigenous communities. He's co-authored several manuscripts and book chapters on the impacts of climate change to Indigenous health, particularly mental health. Dr. Hill currently lives on Dakota and Anishinaabe traditional homelands in St. Paul, Minnesota. Please help us welcome Dr. Kyle Hill. Welcome.
Bonjour, everyone. Good afternoon. I'm very excited to be here. I am, again, as Lauren mentioned, Kyle Hill. I'm an assistant professor in the School of Public Health and the Division of Environmental Health Sciences at the University of Minnesota. And just starting out, so I'm going to share my screen and we're going to get started on a presentation today. And just so excited for this presentation. I think as far as kind of where my heart is, it's definitely in issues around dismantling institutional discrimination, institutional racism, dismantling white supremacy, and just kind of uplifting our values as a community, especially within Indigenous communities. And so there's nothing more pressing to me as a Dakota person, as a Lakota person, as an Anishinaabe person, as looking at climate justice approaches to as a perspective of health equity within our Indigenous communities. And so that's what I'll be talking about today. And so just as a brief acknowledgement, I just want to show you kind of my reason for being here and what gives me energy and where I find my strength and love and softness every day. So this is my daughter, my dad were at ceremony there on the left. You can see the tents in the back, and then my partner, my daughter, my mom, um, some things I enjoy doing, dancing at powwows and stuff like that. So my daughter just turned 1 year old. So it's very, there's such a beautiful lightness and softness to that. And then also when I think about climate change and stuff like that, there's um, kind of a brutal reality that shakes me almost every day, and which is really difficult. Yet, um, so I'm trying to, I think, balance that as a person, as a human being, um, and hopeful that we can affect change for our next generation. But as Lauren mentioned, I'm really grateful and honored to attend today from my home on our Dakota, on our traditional homelands, which we um, know as Amnesiaska Otue, which is the city of St. Paul. And I love to start by just highlighting um, this space here, which is Bedote. And I've, as a point of pride, uh, this is one of our sacred places as Dakota people, which is the confluence of the Minnesota and the Mississippi rivers. And I enjoy telling the story, so I tell it all the time now. So when we had our daughter, we looked for a place to. We're thinking about burying the placenta, which is a kind of a traditional activity, spiritual activity after. Um, it's giving back of that life source to the earth from which we come from. And we thought about burying our placenta in the back of our house, and the thought of like, well, I don't know if we're going to live here, so it's going to be weird for our baby to go check that place out. We know when she's 15, 20, 30, 40, 50, wherever, whenever. And so what came to mind was doing that very profound spiritual work, but burying it at Bedote, which is right now it's called Pike Island. I think it's a state park in Fort Snelling State Park. Um, very colonial, right? And this being a sacred place for Indigenous people, for our Dakota people here, that we were exiled in the 1862 U.S. and Dakota War. It was, kind of decolonizing, I guess, if we want to put it in certain terms. What we didn't realize, so we went and did that. It was very awesome, touching, and beautiful. Afterwards, months later, what we realized was that a friend of ours who was doing work and was one of the researchers on the Truth Project, which really raised up the concerns about the Morrill Act and the University of Minnesota as a land grant institution. In that process and some of the qualitative work they were doing, there was community members that discussed the historical relevance of Bedote, and in particular that Dakota community members, women, birth workers, they used to go to Bedote and actually give birth historically. And so it was a really special way to recognize it. And of course, it was trippy, because I'm like, how did that happen? Right. I didn't know about that before, but somehow I knew that maybe it was important to put our placenta there. Now, I mentioned this as a story to just begin the talk, because when we think about climate justice, we need to talk about rematriation of our lands. And I think that is such a good example of what that looks like in practice. Yet there are a lot of obstacles and challenges to that. One is who knows about the legalities of us digging and burying at Pike Island, right? Not that I care so much, but those are things that are very secondary to the actual act. But those issues persist, right? And so from a perspective of thinking about this movement of land back, right? It's not only like physical land back, which is of the utmost importance for decolonizing. It's also taking our ceremonies back and those ceremony spaces back, because those have raised us as time immemorial, right? So as we move forward here, I just want a broad overview. I'll start with the tenets of climate justice, and we'll work our way into talking about the impacts of settler colonialism on Indigenous community wellness and social ecological resilience. We'll briefly visit the disproportionate impacts relative to the contributions to climate change globally, and then, of course, discuss what does climate justice actually mean? What does it look like? And then we'll discuss the indigenous traditional ecological knowledges, the capacity for climate adaptation vis-a-vis the ITEX, as I call them. And then we'll briefly just discuss a more recent secondary data analysis on indigenous eco-relational engagement, which is a paper that we submitted for the Journal on Global Mental Health. It was a journal called Special Issue on Climate Change and Mental Health. And so with that, we'll just get into it. So the tenets of climate justice within Indigenous communities is that this era of human-induced climate change, or what we call the Anthropocene, is colonialism, right? So the climate impacts fall disproportionately on Indigenous and other communities of color, whether that's, and that includes also other vulnerable communities, children, elders, folks who live with disabilities, right? And so, but specifically for today, we're going to be talking about how this era of climate change, human-induced climate change, is particularly targeting Indigenous communities here domestically and globally. And two, another tenet of climate justice is Indigenous traditional ecological knowledges offer decolonizing alternatives to Western Eurocentric adaptation, and can work together for more of what we understand, or what Albert Marshall has coined as two-eyed seeing approaches, which is Western and Indigenous sciences working together. And then finally, and this is not exhaustive, but honoring tribal sovereignty and Indigenous rights is key to reparative frameworks and land back movements. So reparations, if we think about that as kind of leveraging that for climate justice concerns. And I think land back in particular, the idea here, which I revisit later, is that 80% of the world's biodiversity is stewarded or caretaken by Indigenous communities, yet we only occupy a very small area of our Earth's surface. And we only have land rights to a very small area of Earth's surface. And so, in order to really reconcile that understanding with the important climate adaptation mitigation that needs to occur, the obvious answer is that Indigenous peoples need to reclaim like territorial land rights for their traditional territories, and that would benefit all of us. So this is we think about creative resistance. What you see, colonialism caused climate change. This is some of the art that we did. I helped with at COP26 in Scotland. And there was a lot of artwork that went into those demonstrations, rallies, and protests in Scotland, and they continue to occur. But this is probably my favorite. And so what we'll talk about today is as a process of colonialism is if we look at colonialism from a bird's eye view, we want to think about it across three different I want to say the word era is coming to mind, but as a process, just three different pieces of the process, I guess, right? And so just at this point, I give this talks of these nature so much, I feel almost numb to it, but just a trigger warning. If you need to get off camera and take care of yourself during some of this, it could be pretty heavy. And so if there's anxiety, feelings of any of those types of negative feelings, please take care of yourself. If you're Native or Indigenous or however you show up, feel free to use your medicines and get off camera during this. But I think about this process of dispossession, or this aspect of the process of colonialism, as this is where the genocide took place. These are the very tangible. These are where the massacres of our people took place. Whether that's massacres of large swaths of like our communities, our lands, our spirituality, gender roles, subsistence methods, our wombs, language, knowledges, children, etc. The dependence aspect of it is what we often kind of reference as kind of maybe neo-colonialism or post-colonialism. This is like welfare programs, subsistence policies, the Indian Acts, the Removal Acts, etc. And then finally, the continued oppression is the human civil rights violations, underfunded, inequitable resource distributions to our organizations that serve our community members today, inadequate and underserved systems and institutions, whether that's the Indian Health Service or other systems and institutions. The treaty violations that continue to occur and have occurred even within our own states. And so if you look at the treaties as they're originally drafted, let's say, take for instance, I want to say the 1876 treaties in Oceti-Sakowin territories, you see them gradually shrink and shrink and shrink and shrink and shrink. And so the incarceration rates, and of course, the health inequities that we see today. And so, again, these are some of the pictures that come up for me when I think about those times. Of course, this one on the left was a very deliberate and calculated genocide of our, what we call them as Pateoyate, which is our Buffalo Nation. These are our closest relatives, honestly, as if you're from Oceti-Sakowin or Lakota, Dakota, Nakota. And so this was a massacre on a large scale of buffalo, to the point where they were subsidizing community members and individuals to just indiscriminately shoot buffalo wherever they stood, wherever they found them. I've also heard, read and seen documents where folks were offered, because this is when the railroads were being built, just ride the rails and just shoot buffalo right from right off of the trains. And so if we want to get an idea of where hunting for a sport came from, or all of that, this is part of that history, unfortunately. And for us, we use them for ceremony, for food, for clothing, for all of it. I mean, it's a very important relationship and continues to be. And then on the right, you see this would be a flyer that people would find. And this essentially says you could buy land in Oklahoma. And this is all treaty lands, or was treaty lands and was indigenous lands. And it says 350,000 acres will be offered for sale. And you could buy land in Colorado for $7.27 per acre, it looks like. Um, and there was 5,211 acres for sale at that point. And so just to give you an idea of the scale, this was indigenous lands, 1776 moving forward. And you could see here the westward expansion, or what we understand as the doctrine of discovery, which is essentially a moniker, a mantra for that time was um, expansion at the expense of occupancy. So the idea was, I don't care who's there. The Euro settler, this manifest destiny, whether it's gold or resource extraction, we're going to take the land regardless of who's there, right? And so this was what that looked like, just from looking at the land. And of course, now this is a more recent Bureau of Indian Affairs map of where our tribal nations reside. And so you'll see that there are very few tribes that are east of the Mississippi River. Most tribes were made to settle on the west of the Mississippi. And you'll see kind of where we're at over, oops, my bad. So we are like right here, and this is Dakota territory. And so my dad is from right here. So we were exiled from here over in St. Paul, Minneapolis, to be made to go to South Dakota and stuff like that. So, and so just to put it into perspective, Farrell and colleagues did this really amazing study about 2 years ago now, maybe even 3 years ago. In 2021, they published it. And so the coextensive aggregate reduction in lands, cumulative coextensive lands for indigenous communities was almost 99%. And so right now, our indigenous communities in the U.S. occupy only 1% of their homelands, of their territories. And you'll notice that the 42.1% of tribes from the historical period have no recognized present day land base. So 42.1% of the tribes from the historical period have no land right now. And then, of course, this is only the tribes' present day lands. Tribes that have them is only 2.6% of their historical land area. And then I think what's also notable when we look at this is that the average forced migration distance, let's say when tribes were forced to move from their territorial homelands, we could say the Black Hills, for instance, right? Once there was a signal that gold might be in the Black Hills. Our communities were forcibly removed from the Black Hills. And so the average forced migration distance for indigenous communities was 239 kilometers. The maximum forced migration distance was 2,774 kilometers. So just to put that into perspective, that's a long way to walk. That's a long way to have to be forced from the land that right? The place that we call home. And imagine that today, right? Imagine that today. And I think when we look at these numbers, we have to recognize, in order to appreciate the impacts of this historically, we have to be able to recognize and take perspective of these communities, of our community members that think about this, that are forced to think about this on a daily basis, weekly basis, or monthly basis. And so on the bottom, what you'll notice, I know it's not highlighted, but the present day homelands have more extreme heat than historical homelands. And we understand this is likely due to climate change, rise in greenhouse gases, CO2. Precipitation is lower than previously. Mineral value potential of present day lands is less than historical homelands. And now what that is referencing is just like oil, deposits, aquifers underground and stuff like that. And so I wanted to bring this up. This is a more recent, this is really hard to read because it's very small, but I just wanted to bring this up because globally, I was a part of a group of authors that wrote this it was an article on race and discrimination and climate change. And so globally, what you'll notice is in the top left of your screen, the CO2 emissions in excess of a planetary boundaries are disproportionately greater in developed industrialized nations. The US is, of one of the greatest emitters of CO2, what you'll notice here. But yeah, what you'll notice is that also the deaths from climate related health factors, risk factors, are happening in non-industrialized, non-developed countries, namely Africa, on the continent of Africa, right? And so diarrhea deaths, risk of malaria per 100,000, morbidity and mortality of heat-related deaths per 100,000 down in the bottom left corner, deaths related to undernutrition per 100,000. And so this is just to give us an idea of, if we take that lens from just the US outwards, a lot of our communities of color, those who already experience disproportionate risk factors related to discrimination, marginalization, disenfranchisement, Indigenous communities are shouldering the burden of other industrialized nations, right? And I always get, it always bothers me to see the disparities in the US, because when we look at this, other communities or other countries will say, well, the US is such a problem country, their health indicators are, some of them are lower, as we know, like the infant mortality rates and stuff like that. But by and large, you don't see the Indigenous communities struggle every time we pull up health information or indicators or indices of the well-being of our country. And I find that so problematic because we're at a juncture where there's the disparities or the proportion is just so imbalanced. And so Indigenous communities, Black communities, we all experience disproportionate morbidity and mortality across so many indices, and it's just not recognized. It's almost like there's an erasure, there's an invisibility of our health issues when you broaden it out to really global scales. And so moving forward, relative to climate risks, what does justice look like, right? Well, we know we're at risk because frameworks for climate-related health impacts recognize Indigenous communities as at risk due to our interdependence or relationship to our lands that we share, and our dependence on our homelands, our traditional lifestyles that we're trying so hard to reclaim and hold on to because that's who we are. The culture and food systems, right? There's tremendous food and water insecurity that varies between communities, right? Some of you may be aware of Navajo Nation and that struggle for, and other Indigenous communities like the Wallapai communities, some Apache communities, certainly those ones in California, but these communities that are struggling for the rights for the Colorado River. And then there's communities that have been dammed by the Army Corps of Engineers historically, and that has had incalculable kind of damage to their water security, their foodways, their ability to take care of themselves, right? And so, and yeah, that's kind of all over the place. So it's really, from that, it really gives you an idea of the architecture of the colonial project and the the complicity of the Army Corps of Engineers in particular, but how they were leveraged, right? We think about, we might be talking about the Battle of Little Bighorn or whatever. We might be like, oh, the 7th Cavalry and Custer, all this stuff, Custer died. And, that's maybe a point of 1 point, but then we have to think of like, okay, the Army Corps of Engineers were leveraged at many instances to develop, and this negatively impacted Indigenous communities, often downstream from the developments, right? And that's not to it's not to also say that extractive industries and for-profit industries also did their fair share and have, shoulder a huge amount of responsibility for climate change as we know it today. But some of the climate-related risks to Indigenous communities, melting sea ice, rising air temperatures, surface water temperatures, and this is actually happening in our Great Lakes right now. There's lower ice extents, lower duration of ice extents, so ice is melting sooner into the spring after the winter. Of course, rising air temperatures and surface water temperatures. A lot of fish and wildlife are having to go to different parts of the waters to be able to, for their livelihoods. Extreme precipitation events, smaller average winter ice extents, problematic in Minnesota. And then I think, as we move forward, just recognizing that our Indigenous traditional ecological knowledges is really functions to help us adapt to our climates, but also are the foundation of our relationship to our homelands, which is really the bedrock of our spiritualities. And so when I have taught, namely like courses on health policy, Indigenous research methodologies, I talk to my students a lot about this, is that our epistemologies and our ontologies, so our ways of knowing and our ways of being, existence, are really weaved quite intimately with our traditional ecological knowledge systems and the earth and our lands and then they function kind of in that balance. And so we'll move forward. So getting a little bit more into this interdependence with land. One of my colleagues, Dr. Nicole Redvers, who since moved to kind of head her own planetary health, Indigenous Planetary Health Center at Western University in Ontario, Canada. They did a really cool study looking at Indigenous activists, elders, all these folks they brought together. And what they found, looking at the determinants of planetary health, was that our interconnectedness with land is a planetary determinant of health, which means that our relationship that we share with the land, what that looks like, and this is Indigenous people, but when we broaden it, it includes all people, that our planetary health, the health of our ecosystems, is reliant on this too. And so if we're doing gardening, guerrilla gardening, or whatever we want to call it, we're we're doing our part. Like our planetary health is it needs that, it requires that to be healthy. And so when I think about climate adaptation and planetary health, it really is of like, we have to see ourselves as one community, right? And I think One Health is a way to think about that too. But yeah, like the land, one of the easiest thing to say is that the land is us and we are the land. And certainly this is our perspective as Dakota people, as Anishinaabe people. But the land is healthy when Indigenous peoples are healthy. And when Indigenous peoples are healthy, the land is healthy. Now, we may not think that that may be very simple, but if we look at health equity today, it's clearly not as easily championed or recognized as we might think, right? So now there's billions and even trillions of dollars going into climate change. If we look at the um, Inflation Reduction Act and stuff like that. And yet at the same time, health equity is kind of getting shortchanged, right? And I say this because the Indian Health Service, which is the principal service provider for Indigenous communities, is tremendously underfunded. And so how do we balance the two? How do we reconcile the two? Now, of course, climate change impacts globally, impacts our, federally, our state, our local communities. Indian Health Service services only the federally recognized Indigenous communities from the US. But if we're truly to stand by these words, like the land is us, we're the land is healthy when Indigenous peoples are healthy, again, because we're caretakers of the land, then we need to really start championing those efforts on both sides of that. And so thinking about climate justice and climate resilience, taking a bird's eye view of what this really means with what's already been presented is, first and foremost, we need to articulate Indigenous conceptualizations on and approaches to health and champion those. And through policy, through legislation, through funding, and also like developing pipelines for this work to be done, to build and develop capacity. And also what that means is decolonizing a lot of the efforts that we still continue to, I want to say, just passively ignore and allow to keep occurring, and then also two is developing interdisciplinary collaborative approaches and active engagement between and with tribal communities to recognize Indigenous knowledge systems along Western scientific approaches, And I'm grateful to be at a place in the School of Public Health and the Division of Environmental Health Sciences where I think we have a lot of opportunities to leverage these strengths. Number three, is to leverage and build on sociocultural strengths for Indigenous communities. And, again, if we can appreciate that Indigenous traditional ecological knowledges carry the potential to really have positive impacts on climate adaptation, the first step is to leverage and build on the sociocultural strengths of these communities. So developing programs, funding initiatives, policies that incorporate traditional activities, cultural activities into our programs, whether that's, and we could use our educational system as an example, but looking at how do we develop initiatives for things like language revitalization, language nests, because those are associated, as we'll see later, with our traditional activities and those practices. How do we do that in our middle schools? How do we do that in our elementary schools? How do we do that in high schools? How do we do that in our universities? Because the idea is we need our children to understand and recognize this at a much earlier age than, like, for example, I understood it and recognized it. I'm not saying that I'm too late, but like when you start to understand this in your 20s and 30s, like it's we're behind the curve. You know, we want our children to have language and the language to the land and that relationship as early as 1, 2, 3 years old and 4 years old, right? Anybody who lives in Minnesota who has played hockey can understand that, right? If you start skating at 20 and 30 years old, you know, your hockey career is probably not going to pan out. If you start skating at 2, 3 years old, you got a shot, right? And I think that's the way we need to look at some of these things. You know, you have to use these like analogies for how we see the world and be like, okay, we really need to start teaching kids, you know, this. Um, and then, of course, from a health equity lens, we need to develop strategies to affect change on the root causes of vulnerability, which is um, looking at colonialism and social and ecological determinants of health as really kind of bedfellows. Like it's really the same. I mean, if you're championing health equity, you don't want policies that really that are you know disproportionately discriminate, disenfranchise, or marginalize our communities of color. That's not what we're about. Um, and so at the same time, we need to champion these strengths-based solutions, which are the culture, um, the languages, the life ways, the traditions, the traditional food systems, right? Um, and if you look at settler colonialism, those were the targets, and they were targets for a reason, right? It's the same thing when we look at resilience, right? Resilience, a lot of some of the literature will say that protective factors is just the opposite of the risk factors. If you see risk factors, you know, flip it on its head, do the opposite, you know. So some of this is simpler than I think our policies will have us believing. And enhancing climate related health risk management. And I think this is where the two-eyed seeing approach comes in. You know, we need surveillance, we need measurement, you know, and so that is important. Um, strategies, policies, and programming that return land to Indigenous communities. Again, here, you know, this is not a you know, we need more land. I think when we look at a climate justice approach, is like we want our land back so that we could treat it the way treat it from a place of love and care and just spiritual reverence that we've done for centuries upon centuries upon centuries and centuries and generations, right? And so I think that when people hear land back, it's like, oh, you want my home and you want my backyard and stuff like that. It's like, well, one, we need to recognize where we're from, right? A lot of us and you know our families and stuff were welcomed here, right? And so as we settled here, we're welcomed here. This is our new home. We also need to recognize that this is also someone's home, and those folks stewarded the land in a very effective way. And now, how do we all come together over this big issue that affects us all to make sure that our lands are taken care of for all of us, you know? And so there's a lot of feelings when people talk about land back. And so I'm recognizing I have about 20 minutes left, so I'm going to try to get through the rest of the slides a little quicker. But this slide, blueberries and birch bark, I just wanted to point out because I remember I was talking to someone and they're saying if you're an Anishinaabe person, you know you're home when there's blueberries, there's birch bark, and there's food on the water, which is monoman, right? And so that's your traditional territory. And so this indigenous traditional ecological knowledge is, and we say knowledge is because we come from a place of plurality, of pluralism. you know, instead of like being monothetic or I forget the word, but you know, there's so many knowledges out there. If we think about the 574 federally recognized tribes in the US, there's 300 languages, right? And so if we just think about the land base, each ecosystem, those knowledges represent the ecosystems that they adapted from. The languages represent the ecosystems that they adapted from. And so if we're thinking about doing adaptation programming, we have to recognize the language of that land, the indigenous traditional ecological knowledge systems that developed from that land, right? And so if you're using an Anishinaabe perspective for California, lands in California, that's inappropriate, right? And so maybe the epistemology or the ontology is kind of like it's important to take that with you, but yet we wanna look at things from the local communities and from the tribal communities that are there. And then again here, just pointing out that in this for the determinants of planetary health article, one of the things we recognize is that Indigenous communities caretake for 80% of the biodiversity, despite only inhabiting 22% of the Earth's surface. And being like, I forget what the actual numbers and very small percentage of the peoples on Earth, right? But what I'm going to go into pretty soon is a paper that I guess it's submitted, it's in review, and at the journal about indigenous eco-relational engagement, which is place-based spiritual, cultural, and traditional languages. Our traditional activities and language facility is related to positive mental health and flourishing. And so we see that these relationships are there for Indigenous communities, and it's just about fostering them, honoring them, and really utilizing for climate adaptation programming. And then I did want to talk a bit about Indigenous intermediate determinants of health. And so when we think about the determinants of health, the ecological, social determinants, we think about it as kind of a tree, whereas the canopy is kind of like the proximal determinants, the trunk of the tree is like the intermediate determinants, and the roots is really the long-standing, deeply rooted issues, which I think about colonialism as like a rooted issue, right? Those that have very deep ties to our social determinants of health. But the intermediate determinants of Indigenous health are things like kinship networks, our relationships to land, our languages, our ceremonies and spiritual connectedness, our cultural connectedness, hunting, fishing, and gathering. Those are really concrete examples, as well as storytelling and knowledge sharing. And that's my pretty baby on there. It's my daughter. We were picking blueberries, and it was actually at a blueberry farm. So I'll be honest about that. It wasn't like super, super wild. We didn't find that little blueberry patch, but it was just so cute. She loved it. She was literally like picking them off and trying to eat them. And so finally, I'll go into this paper a little bit just to kind of give people an idea of what this actually looks like, Indigenous eco-relational engagement. So this is really a first step into doing this work. And this came from some literature on cultural connectedness. And so cultural connectedness really discusses the utility and preventative benefits of cultural identity, spirituality, and traditional activities within Indigenous communities. Much of the work that I looked at comes from like Canada and some other places. But what I was seeing is that this is associated with positive mental health. So it was really just made me excited. I was like, what, you know, there's work out there being done that tell us what we already know, that our cultures, our spiritualities, and our traditional activities are associated with health and wellness. Like um, that's kind of like in jest, but for real, like for some reason, like our when you go talk to our elders and stuff like that, like a lot of the knowledge sharing and storytelling is like, wow, like this is important, beautiful knowledge. But the public, for some reason, are especially as our institutions, policymakers, they don't listen to any type of any type of knowledge until it's published. And it's so bizarre, but it continues. And so what we realized, though, is that cultural identity within cultural connectedness and in other studies is difficult to measure across Indigenous communities. I mean, think about it. You know, we just take the federally recognized 574 communities. It's hard to just use one cultural identity measure to like tap into the same construct across different communities. And what we also looked at and listened to is that Anishinaabe youth concepts of positive well-being were associated with culture and traditional teachings, and also language. And so, oh, that was also a slide from there. And so, Indigenous eco-relational engagement is really what we keyed in on. And so because we used language instead of cultural identity, we just made it, you know, a different concept. So Indigenous eco-relational engagement is essentially Indigenous culture, traditional and spiritual activities that are key in decreasing the harmful effects of historical, intergenerational, complex drama, as well as associated symptomology, but we use language here. And so apparently my caps lock was kind of crazy on that, but you know, that happens. So we use language as a land-based indicator of kinship. So it was novel in that way, but I think from a personal experience, every time you go to maple sugar camp, or you go harvest wild rice, or you go to community events, you go to ceremonies in our communities, people will be speaking our traditional languages. And so we really wanted to kind of give that space to really come out. And so that's what Indigenous eco-relational engagement represents. And so it's really an active engagement of these Indigenous traditional ecological knowledges and associated land-based practices. And just knowing that Indigenous knowledge systems and sense of being is rooted in the kinship to place. And so that's where, you know, that was the meaning behind that. So our purpose was to determine whether Indigenous eco-relational engagement is related to Indigenous concepts of wellness by way of, you know, and we used a composite variable, and we picked out kind of place-based and ecocentric determinants of culture, spirituality, and language. And positive mental health is the kind of indicator of, you know, how is this really working? And so what we found was that there was a relationship between using correlations, which I'll show you later, between Indigenous eco-relational engagement and positive mental health in our communities. And the aim was to provide the opportunity to promote wellness and kinship to land by way of engagement of ITEX. And so really where this is going is looking at adaptation programs. And so see, this is our research question here. What is the relationship between nature-based traditional and spiritual activity participation, traditional language use, and positive mental health among American Indian and First Nations adults? And so the participants were from a long-standing longitudinal study called Healing Pathways, which is the PI is Melissa Walls, who used to work at the University of Minnesota. Really good, consider a good friend and mentor of mine. So the mean age was 26 years old. And of course, these folks were from 8 reserve and reservation communities in the upper Midwest from the US and Canada. 3/4 reported past year income of less than $24,999. And so that becomes important because when we look at the analyses, well, we'll get to it later, but more than half are female, resided on the reservation or reserve, reported a high school diploma or less for highest educational attainment. So again, the methods. All of our communities share common language, beliefs, and traditions. Tribal resolutions were sought prior to the study. Community research councils were developed. And then if we want more information about that, I can give it to you. So the measures we used, again, we use this composite variable, Indigenous equal relational engagement, recoded to binary coding, past year participation in 9 nature-based traditional activities, which is ricing, spearfishing, collected maple sugar or syrup at camps, picked berries, hunting, gathered birch bark, gathered or cultivated kinnikinnick, samar, tobacco, just all of these different things, collected herbs or medicines. And then 2 traditional spiritual activities, which is offering tobacco or participating in a nipi or sweat lodge. And then 4 language variables, which is, do you understand some Anishinaabe language? Do you easily understand spoken Anishinaabe language? Do you speak some Anishinaabe, or do you speak it conversationally? And so for myself, I understand some language, and then I speak some, very, very small, right? Very small amount. I would say, and this is not even a knock on me, but I would say I'm like 2-year-old in language, in Anishinaabe language, right? And so if we think about where we want to get to, it's like we want our kids to be able to do this stuff. That's what we want moving forward. And so it showed pretty solid internal consistency. And the outcome measure was really the measure called the flourishing scale, which is really just positive mental health or resilience scale. It's been validated across age groups, applied cross-culturally. And for this study, positive mental health was measured as the sum of the recoded versions of the flourishing scale variables. And so we used a linear regression with robust standard errors to estimate the association between Indigenous equal relational engagement and positive mental health in both unadjusted and adjusted models using R. And so what you'll note here is that across low, medium, and high positive mental health, the number of nature-based activities, nature-based spiritual activities, and language engagement increases, right? So if you are high positive mental health, if that's what you endorsed, it's higher likelihood that those folks were engaging in more of these activities, right? And so you can notice that also in the IERE composite as well. And so that was really awesome to see. Of course, it's just a basic correlation matrix. You'll notice that a lot of them are intercorrelated, and of course with the IERE composite. And then finally, we were really happy that we were able to see this, these positive relationships between Indigenous equal relational engagement and positive mental health in both unadjusted and adjusted models. And I think what also struck us was just the significance of the income factor, right? The negative relationship with positive mental health with those having incomes below $24,000 or $25,000. And so I think a matter of equity, it on a very personal level, it made me realize how much I forgot of what it means to be poor, right? We grew up on assistance. We grew up on like Section 8 housing vouchers, all that. And, you know, like my family's doing good now, but I don't know, it just brought like kind of a weight to it, like these findings. And so I think we need to focus on our people that are struggling with poverty, you know, that are having struggles like that, and start to develop initiatives that get folks out there doing these things. But more importantly, I think teaching how to do these things, and so people are comfortable, right? Um, but I say that because none of these things, Indigenous equal relational engagement, all of these things, going back to like my grandmother's generation before that, never required money. But now, like, we need gas to get out there. We need, you know, sometimes in order to be a part of these things, people have to pay or something like that. But you know, that's just a note to consider, is if you're ever coordinating a program, leading a program, or a part of a program that makes people pay, are we're doing the wrong thing, right? Because a lot of our community members are poor, you're right, and all of us have been poor. Many of us, as Indigenous, like Native people. Um, so, all right, I'll move on. So, really, the findings demonstrated what we thought. You know, those are research question, our aims, our hypotheses, that Indigenous equal relational engagement significantly associated with positive mental health. And so this again reifies the importance of cultural activities, traditional activities, spiritual activities, and language, as they're all related in promoting positive mental health and well-being within American Indians and First Nations communities. Um, and so some of the implications, I've got about 2 minutes left and just a couple slides. This really contributes to the gap in literature examining the relationship between cultural engagement and positive mental health as it pertains to nature-based determinants of health, ecological determinants of health, and associated impacts on Indigenous health and well-being. And then this IERE incorporates what we understand to be like a Indigenous traditional ecological knowledge framework, and which is really the land-based relationship between humans and nature, is vital, like I had mentioned and showed earlier, to our planetary health, but it's also vital to our health, right? So it's really that thread that binds us as Indigenous people. And so previous investigations have provided clear evidence that historical loss and generational trauma is tied to poor mental health among Indigenous people. And so this really represented a strengths-based approach to recognizing place-based culture, spirituality, and language wellness promotion within our communities. And so it's an opportunity. This is an opportunity to really champion efforts that both lift up health equity within Indigenous communities, more of a decolonizing health equity approach, and also the climate adaptation, right? Just some more fun pictures. That's us harvesting wild rice. This is a little relative at the No Dapple camp in Standing Rock in 2016, 2017. And then, of course, on the right, this is over by, I think, is it Tetaguchi State Park? Over by Duluth, up north of Duluth on the North Shore. This is Gichigami, our Lake Superior, very sacred place to our Anishinaabe peoples. And then if you could contact me, this is my email and stuff. And then, of course, the IERE work, that secondary data analysis, was supported by the National Institute of Drug Abuse, the National Institute of Health, under this award. Of course, Dr. Walls is the PI on that. And then that's it. Here's a couple of references. Otherwise, that is it. Miigwech, I appreciate everyone's. I'll stop sharing and we can take some questions. I hope everyone heard me because I haven't looked at this chat the entire time. Hockey analogy, good. I knew there was someone that was gonna be like, yes, from Minnesota. Um, yeah, yeah. I started skating at 7 or 8 years old, and I lived in Grand Forks, North Dakota at the time. And I was like, we lived in a low income housing. I think my mom like got all this hockey equipment from one of her friends or something. They donated it to me. And I went to go to tryouts, and the coach was like, and I was like working hard. I was at the skating rink like every day, but I didn't know how to skate before that. And the coach, of course, if you're in Grand Forks, hockey's big, just like here. And the coach was like, um, you're not like essentially, was like he's not good enough to be in mites or mighty mites, and so we're gonna put him in the lesser one. And I felt like I don't know, like I like basketball more anyway, so I just like put my all into basketball at that point. I was like, you know what, like I'm not a hockey player, I'm a basketball player. So yeah, all right. So should I go into the questions? I'm kind of looking at them, or
Yeah,
um
I was gonna ask
okay.
you if you are comfortable doing that or if you want.
Yeah, I'm totally cool with that. So someone said I think you were muted. Oh, never mind. That may have been way a long time ago. Truth Project. Thanks, Lauren, for putting in the Truth Project stuff. That's really important. It surprised me that when I interviewed at the U of M, very few people, faculty, leadership knew about the Truth Project. Um, let me see. Can you recommend Kelly Johnson? Can you recommend any resources for the parents of infants and young children to help their kids develop these ways of being and knowing early? I think there are like language nests that are popping up and proliferating, and I know that the Biden administration has put just recently some funding into culture and language for Indigenous communities. And so I imagine a lot more of these language nests and immersion programs are going to be starting up. But if you're in the Minnesota, Wisconsin, maybe you could email me offline and I could give a better idea. I know that there's Montessori, Indigenous Montessori programs here in the cities. Um, there is a language nest that starts at 3 years old. And so our baby will be going into those things and then teaching us, I'm sure. And then, so yeah, and then the digital map about the loss of Indigenous land is quite striking. Could you say more about how it was developed and whether we can access it to use in our courses? Also, thanks for disaggregating the data and climate impact. Where can we find accurate visual comment? Other communities in the US. Yeah, so Annette, the map GIF or whatever, I'll have to find look again where I found that. I might have borrowed it from someone else's presentation too, so it's like shared across colleagues. But the BIA one, you just find at Bureau of Indian Affairs, and then the study by Farrell and colleagues, I could send that to you if you send me an email. Altogether, I think those are pretty compelling in and of themselves. The one about the global health, the global disproportionate global impacts is from an article that I helped co-author that was published in the Lancet like maybe 3 months ago. It was called like I could put that in the chat actually. Um, let me get that real quick. And so you'll find that in there. But yeah, that's a really good one to look at because it was actually um, a um, a literature review in addition to some kind of lived experience policy work as well, and then that map. And so case studies are included in there. So I put that in the chat if anybody wants to take a look at that. It might be kind of highlighted on. Oh, okay. So someone said, I want to share some great work that the Fond du Lac Band did on monomen and mental health. Yes, I saw that not too long ago. Haven't gotten a chance to get into it yet. Thank you, Jocelyn. And so actually Melissa Walls, the PI on the manuscript that we did, actually had a hand in doing this too, in helping with it. So that's pretty awesome, full circle. What is a good model or involvement approach to actively and respectfully engage tribal communities? How can local, state, federal do a better job of working collaboratively with tribal communities to balance power sharing? Do you have any experience or examples of legit power sharing? I'd say just meeting the communities where they are, and I think what I'm realizing now is that there are some intermediaries like NGOs, nonprofits, that are better than our academic institutions at doing that formative work. And so I think it's really important when we take a whole of community approach to develop like subcontracts or sub awards for some of these NGOs, nonprofit organizations, and tribal organizations to help us make those connections. And most importantly, to defend against any unethical kind of improper, inappropriate power dynamics with the communities that they share, for lack of a better word. Let me see. But I can offer I believe I have a good example of something that I also helped with a couple of years ago. So this is culturally safe research with Indigenous communities. So there's another article inside of the chat. Let me see. This is really neat info. Thank you, Annette. Do you recommend any specific app or program to help people learn native languages? I think there's a few of them. I know Anishinaabe or Ojibwe language. I think there's a Rosetta Stone out there. Dakota language has an app. And in Lakota language, there's some apps out there too. So just check it out. Yeah. Are there times in which connectedness with Indigenous culture can negatively affect mental health? For example, being aware of historical trauma and really feeling those losses on a regular basis. Hey, Nikki, how are you? It's good to see you. I want to say this is a trick question because I feel like you know this, but some of the work that was previously done on culture as a measurement on cultural identity and some of these other measures. Once, I want to say this correctly, once kind of historical loss, kind of this concept of recognizing what we've lost as a peoples, as a culturally, linguistically, resources that we've lost, the people we've lost. Once we input that into models, measurement models, in addition to measures of discrimination, those kind of attenuate some of the negative effects of when we have culture-based measures inside of a model, if that makes any sense. So it essentially, like, we have to account for things like historical loss, and we have to account for the contemporary impacts of discrimination. Once we do that, I think we have a more solid indicator, a more solid model of the actual impacts of culture, whether that's in health equity approaches or whatever. But without that, there can be some negative effects of just using culture or traditional activities and stuff like that, right? And so Nikki brought up a really good point, and I may not be representing that in the most exacting ways, but I think I'm pretty close to that. Let me see if that makes any sense. And again, like I said, with cultural identity, that is a very, I think, unwieldy is the best term for that. Concept to measure, because there are so many different Native communities. So if we take like Minneapolis, for example, or St. Paul, our Twin Cities community, you have Indigenous people from 20, 30, 40, 50 different tribes here represented in this one area. So if we give them Anishinaabe specific cultural identity items within like some type of brief measure, people that come from Oklahoma tribal territories, whether that's Creek, Choctaw, Cherokees, whatever, they're not, it's gonna be different. So what else? Oh, Feather, hi. I'm glad you made it. Thank you. Thank you. Um, any recommendations on what a good takeaway piece or one thing listeners could share with others from this conversation today, from Kelsey Merkins? I would say this idea again, like for Indigenous community members, and what I said, this could generalize to us all, is that really like we are from the land, right? And so the health of one is the health of both, right? And so for Indigenous people, it's like um, Indigenous people's health, climate adaptation programming, look at planetary health initiatives, they have to occur at the same time, right? And because of that interconnectedness, we also have to champion any efforts to be able to fund and resource Indigenous communities to do this work on the land. Those would be my two takeaways. And I think the land back movement as a movement and at its core has those principles of engagement, like pretty like well represented, right? And so there's a lot of stuff out there on land back. If you just type in land back, you'll get like Indian collective stuff. You'll get other stuff, manifestos. You'll get the Red Nations climate book. There's so much out there. And then Jocelyn, how much have you explored about solastalgia or distress to seeing environmental change in your home? Curious to see, since many of the traditional activities you mentioned would put folks in the front line of seeing out. Yeah, I mean, this is one thing, Jocelyn, where I think, of course, solastalgia has been coined amongst like researchers and Indigenous communities as ecological grief. And so that's a part of this. I usually put in a talk or presentation. Today I left it out just because it wasn't like specifically about mental health, and I wanted to talk about this paper that we did. But yeah, certainly I think ecological grief is real. And I think there's a study by Ashley Consulo, I think that's how you say her name. She's a faculty member in, I want to say in Canada, and she leads up a large like climate change and mental health center for Indigenous communities. She's non-Indigenous herself, as far as I know. But in some of their seminal work with Inuit communities in the Arctic, one of the things that one of the participants said was essentially like we are people of the sea ice. If there's no more sea ice, then who are we? Right. And so that line has stuck with me, because that's what it means for all of our communities. And I think what we have to understand and appreciate for Indigenous communities, even though it's scary, is that there's nowhere else for us. Like, this is our home, right? And so for a lot of community members, for example, those people who are at tribes who harvest salmon, like that's their traditional relative. Like I was talking about for buffalo, for folks from who are Ocheti Shakoni, people are willing to go with the salmon. And as sad as a thought of that is, I think the idea is like, if we are not, we do not exist without our relatives, right? And as that's powerful, because if you think about climate change, the disparities in resources associated with climate change, everybody's going to get pressed at one point or another if we don't start to adapt more quickly, right? And that means limiting greenhouse gases, limiting emissions, right? Preserving the Amazon rainforest because it's our biggest CO2 kind of like absorption ability to absorb all the CO2, right? And so it's like if we don't do these things quick enough, like our indigenous peoples are going to feel, you know, basically like we're okay with going with the land, right? And I mean that's a crazy thing to think, but it's not so crazy if you take these if you have these epistemologies and ontologies, and those are the bedrock of who you are as a community. So anyway, without, I could talk about that and get into that for days and days, so I won't bore anybody with all of that. You know, but I do want to just before just to wrap a bow around that, I think recognizing that like planetary health is a lot less gloom and doom than climate change. And it's somehow, in many ways, it helps me to think about planetary health because it's like these are the things that we can do that are going to make the planet healthy. Instead of thinking about, oh, these are all the thresholds that are being crossed for climate change for like a like impending doom, right? So if we start to just do these things that think about the determinants of planetary health, if we start to do those things, like our planet's going to love it. It's going to be healthier. It's going to do better, right? So anyway, I just want to say, miigwech, Pidamiado, like I really appreciate everybody and thank you for this opportunity. And I'll just turn it back over to Lauren and whoever else.
Thank you so much, Dr. Hill. Appreciate you spending time with us. And I hope you all got his contact info in case you want to follow up. And you can put it in the chat again if you want to. So we, again, will have more events coming up soon, and we'll let you know about those via email and the website. If you could fill out the evaluation, we would really appreciate that as we continue to plan for future justice and public health events. Thank you all so much for spending time with us today. Hope you have a fantastic day. And we'll take it from there. Thank you all. Bye.
Bye.